healthcare, there is often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking things down into language you can understand. We create a safe space for you to ask your questions and share a nursing perspective without taking up too much of your time. Today, we're joined by a special guest, Dr. Anyi Atabong, a doctorally prepared nurse practitioner who's dual certified as both a family nurse practitioner and a psychiatric mental health. Is it psychiatric mental health?
Yep, psychiatric mental health.
And she's board certified. We're going to learn about her journey to becoming dual certified and also her business, which is called Capital Multi-Health Group. We're going to find out who's on her team, the services she offers, what the patient experience is like, and of course, we're always going to talk about cost. We really are excited about this episode. We're so grateful that she decided to come on and share her time and expertise because we really think that mental health is super important. We have already dedicated a number of episodes to the podcast, including intergenerational trauma, which we did last year for our Juneteenth special. Then in the winter, we did navigating the holidays with family, anxiety, depression, and suicidal ideation. We recently showed you cognitive processing theory and eye movement desensitization with our in-house trauma therapist, who's a licensed clinical social worker, Kelsey Wilson, who is Virginia-based telehealth practice right here in Northern Virginia.
Nice.
If you're new here, welcome to the Melanin Initiative. I am Dr. Kimberly Madison, a doctorally prepared nurse practitioner, and one of your co-hosts here at the Melanin Initiative, along with Alicia and Geraldine, who send their love in their absence. When we say health literacy, we're talking about your ability to obtain information, to understand that information, and to use that information to manage your health and advocate for others. By watching on YouTube or listening on any of your favorite podcast apps, we hope you feel empowered to ask questions, educated on how you can manage your health, and confident to navigate the healthcare system. If you haven't already, we invite you to subscribe, leave a comment or two. We will respond, and sometimes our guests come back and respond directly to you as well. When you leave comments, when you subscribe and engage with us, it lets YouTube know that this information is important. And so when people like you come to look for information like this, YouTube will make sure that it shows up when they open their homepage or when they go to their subscribe tab. Friendly reminder, this show is for educational purposes only. The opinions expressed here are our opinions alone. They are not a representation of any of our affiliations. If you're experiencing a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. If you're having a physical emergency, you can call 911. And if you or someone you know might be having a mental health emergency, you can call 988. Dr. Anyi Atabong, welcome to the Melanin Initiative.
Thank you. It's such an honor to be here. And I'm just so glad that you and your team are able to create such a platform for nurses.
Oh, yeah. Yeah. And, I'm so glad you even mentioned that, right? Because we do two things with this show. We promote health literacy for the patient, but we also recently started a professional series. So a lot of our experts that come on the show are nurses like yourself, right? Who have all levels of education. And once we get in healthcare, we know that there's a million people that make this industry run. And we realize actually we're not in the nurse business or the doctor business, we're in the healthcare industry. Right. And that is a whole different perspective.
Yes.
And so what we're trying to do through our professional series is just introduce the public and the next generation to all the different opportunities in healthcare, but also give a platform to the nurse perspective. What was your journey like? What's the education? What do you do? What's an experience like with you? Yeah, so that's what we're doing. And so my dad, he mentioned something yesterday, and I thought, I never bring enough attention to this because I just mentioned we create a safe space for people to ask their questions. But he said, because he actually has a lot of health concerns, and so he's in and out of the system quite a bit. And I guess at one point I told him how important it was to ask questions because I'm only with the patient for a little bit, but you're with yourself all the time. And so you really need to know everything I know because you're going to manage it. Your family's going to ask you what happened. That next doctor is going to ask you what happened, what you're taking. And so it's so important. I know we look busy and we are, but it's also our job to make sure you understand and to break it down into language that you understand. And I think nurses, people always want to know what's the difference between a nurse and a doctor. And I think it comes down to that education. It's taking the time. Patients report that that's what they love. They feel like quality time equals caring. That's not always true because everyone plays a different role.
Right.
But that is what That is the reputation we have, right? And I think nurses excel. So we're so excited to hear about your journey and what you have to offer. So let's jump right into it.
Sure, let's do it.
So tell us your nursing journey.
Well, quite interesting. I knew I was going to be in the medical field for sure. And when I'm taking, I started taking prerequisites to be either like in nursing, pharmacy, or even medicine. And so, as I started doing my research, I realized that there were just so many opportunities for nurses. So I went ahead and took the nursing route, which ended up leading me to Coppin State University in Baltimore, where I got my undergraduate degree. And then following by, actually leaving Coppin, I became an ER nurse at Mercy Medical Center, which is like, it was just, I learned so much as an ER nurse. And then, within that experience, I realized I wanted to do more than, treating my patients in that light. I wanted to be able to diagnose in the way that I wanted to. So I was looking to go to Howard University for that. And when I went to get my recommendation letter from Coppin, the dean at the time was like, why would you want to go back to Howard when you can come back here? You're an alumni, come back. And it's going to be a lot cheaper. And I'm like, you know what? You said something. Let's do that. So went back to Coppin, got my master's, became an FNP, and I started working at CVS MinuteClinic. So working at CVS, I realized a lot of my patients were all on antidepressants. You med reconciliations, or you're getting that history from your patients. And I was like, wow, about 95% of my patients were on a mental health medication. So I was like, okay, I want to be able to learn how to manage this a lot better. So I went back and got my psychiatric nurse practitioner. And I fell in love. I actually started off working at an LGBTQI clinic in DC. Yeah, and that was awesome. It was very eye-opening. I learned so much. And then I ended up in a community health center in Northeast DC, where it was a completely different demographic and a different population that needed a lot of health coaching. So it's a lot of teaching. And then it's there where I also really understood the importance of health literacy, because I really had to meet my patients where they're at. And then, of course, nurses, we love school. Nurses love to go to school. Dr. Madison, we don't stop. So I'm like, all right, I got the Psych NP. So what's next? What else can I do? And I was like, you know what? I think it's time to go back and get my DNP. So I ended up going to Duke and getting my DNP there, where I met some phenomenal professors that had just opened up the doors for even more opportunities. And, full circle, I ended up back at Coppin State, where I'm also an adjunct faculty member in the graduate nursing program. So it's so nice to be able to share that journey with my students as well. And, here I am.
Wow, that's awesome. You mentioned Coppin State.
Yes.
And DMPs of color just did like a special on the first 5. Are you tied to that in any way?
Actually, I'm not, but we are one of the HBCUs that has a BSN to DMP program, and they are the first cohort of that program. So Coppin has been so blessed and fortunate to have so many different pathways of nursing. So they are the first for that particular cohort, and we're just so proud of them. They did phenomenal. Their projects were amazing.
That's awesome. Yeah, I think we had them on for like a webinar. I think I mentioned DMPs of color every other episode. The link will be in the description box. Shout out to founder, president, and CEO, Dr. Danielle McCamey.
Yes, she's amazing.
So you mentioned a few words. I just want to elaborate on for our audience, make sure everyone's following. You mentioned prerequisites. What are those?
So those are courses that you would take prior to starting your actual specific journey in whatever specialty that you are looking to graduate in. So most prerequisites would be your basic math courses, your English, your chemistry, your physics, and biology.
Wonderful. And what was your DMP project?
So my DMP project had to do with culturally sensitive mental health care. So what was the view of how do patients view their providers? Do they think we're culturally sensitive enough to treat them, especially in communities of color? So yes, that's what that was. And a majority of our patients, because majority of my patients are individuals of different backgrounds. And so most of them, I want to say about 75% of them agree that they thought that their providers were culturally appropriate, culturally sensitive. We used to say culturally competent, but the literature now has changed. So we don't really say culturally competent, because can you really be competent in someone else's culture?
Ooh, now
Yeah.
that's a Pico question.
Right. So, because when I started my project, we're used to that term, culturally competent care. And my DNP project advisor was like, are we really competent though? Can you really be competent? So I think we can, the literature is now changing from that term. And so we should say that we're culturally sensitive to someone's culture, or we're culturally appropriate. We want to be culturally appropriate in how we're treating these patients with different cultural backgrounds. And I was like, yeah, you know what? You're right. I like that. So
Very nice.
yes.
And then, so let's see. You had said something else. I was going to elaborate on that.
Okay. Maybe it'll circle back around.
Oh, so your project, because we start part of our professional series.
Okay.
Is we have these series. One is called Becoming Doctor of Nursing Practice, where the guest star is Demetrius Kirk from Detroit, now in Hawaii. And so they come on each semester, catch us up on how things are going, because, there's a lot of questions out here about the
DNP. What is it? Right.
The utility of the DNP, right? And so people think patients are confused, that even our colleagues don't understand why we're doing it. And so just like all the other complex things in healthcare, we thought we would just take our time and explain it, because people can understand complex things. And so he's one series. We have Becoming a Physician with Clarence Sams, who's interested in becoming a dermatologist. He's out in California at a HBCU. He's in the first cohort at Clarence Drew. He's in Stanford as we speak right now for the summer. And then by the time your episode airs, we have previewed Becoming a Midwife with Charity Bean, owner of the Doula Lab. Shout out to doulas and Black Maternal Health.
Labs, yes.
And this is the first time I'm announcing that we'll be starting a new series for the fall called Becoming an ICU Nurse. She was CNA, LPN, now she's an RN in the ICU.
Good for her. Yes.
Yeah, because when we talk about nursing, I feel like they get left out. And so I just want to give them a voice.
I love that, because there's just so many pathways and so many avenues of nursing. So I'm so happy that you're able to highlight that. That's wonderful.
Yeah. So let's talk about becoming an entrepreneur. Tell us about the Capital Multi Group.
Girl, so Capital Multi Health Group, so many words jumbled up together, right? And when most people hear or see it, they're thinking, oh, this must be something financial. And I'm like, actually, it's not. And they're like, so where is capital coming from?
Maybe if they're not here, because I automatically assumed it was associated with DC.
Right? So it is. Oh my God, you're like the first person. I was born
because I'm from here.
I was born in the nation's capital, right? So I was born in the capital. So that's where I came up with the name Capital Multi Health Group. And of course, multi meaning, multicultural, multi-services. Mm-hmm. And of course, we're a healthcare group. So that's where that name came from. Did you ask me about the services, Dr. Madison?
Well, just like how did you decide you wanted to start this? Where did that idea
I want to start this? I did not want to start this, to be very sincere. I have an uncle who's my business partner. I actually did my Psychiatric Nurse Practitioner rotation at his practice in Bowie. So did that for about 2 years. And then I, started doing my own thing and was working. And he's like, one day we should open our own. I was like, oh yeah, sure. Okay. So I went about working, and then we're like 4 years down the line, and he hits me up. He's like, are you ready? And I'm like, ready to do what? He's like, ready to open your practice. Like, yee. Right. I'm like, I just want to see my patients go, oh, I don't know about this business thing. And he was like, no, it's well worth it. We're going to partner on this. You're the expert, so you'll handle the clinical side of things. And I'm the expert when it comes to business, because he has multiple medical businesses, and he has an MBA. He's not a clinician, so he just knows how to run medical practices. And he's like, I'll be able to handle that piece. So I'm like, all right, let's do it. So right before COVID, 2019, we opened up our practice. I was still working there and working at another facility, trying to build it and grow it. And then COVID hit. And so when COVID hit, I was like, okay, because we were typical brick and mortar, right? There wasn't telehealth. And so I panicked and I was like, ooh, see, this is why I didn't want to do this. And now here we are with COVID. And, COVID and actually did the opposite. It opened up doors because I specialize in mental health. A lot of people were struggling with mental health concerns and problems. And so that actually ended up bringing me a lot of business and opportunity to care for a lot of individuals in our community.
And was this your first foray into business?
Yes, my very first, very, very, very first. So he definitely held my hand. Okay. And I will say I have learned a lot in business. So, when you think about previous experiences working for individuals and how they used to like put patients on your schedule, and who used to be grumbling like, I got 20 patients, I'm supposed to have 17. And I'm like, well, if we want to keep the lights on, we're going to have to keep these numbers steady. So now from a business lens, I get it.
And so you're brick and mortar and the telehealth?
Yes, I am. I do both now. Because insurance companies are still reimbursing for telehealth services. I do encourage my patients now that, the restrictions are down, you should still be able to come in. So I encourage them to come in every couple months because I want to lay eyes on them from head to toe, get an actual set of vital signs and see what's happening. Maybe bring in a family member, we can get the chit chatting. I'm a chatty person. So I like for them to come in and bring in family as well.
Oh, I like that.
Mm-hmm.
So what's the mission and vision of your business?
So we are professionals dedicated to patient care. Okay. We professional number one. All right. My staff at the clinic, they know you have to treat my patients with the utmost respect. We're human at the end of the day, forgetting all the titles. So when they're coming through that door, I want you to treat them with great respect. And of course, I want you to know that we are professionals. We are credentialed, we are board certified, and we are experienced. Okay. So you're going to get the best. And if you would like, check out my Google reviews. Okay. They won't lie.
So it sounds like you were kind of right before the big wave of nurse practitioners going back for mental health, right?
You know what? You're right, because I got mine in 2017. So it's been 7 years since I've been a psych nurse practitioner. That's correct.
Yeah, and now the trend is booming.
It is. Everyone's going back now. And a matter of fact, Coppin State just got approved for their postmaster's psych nurse practitioner certificate. So I want to say we're probably like 1 or 2 HBCUs now that will offer that, because we find that a lot of individuals are going back. Yes.
That's what you had said earlier. You had mentioned that Coppin is one of the only HBCUs that has the BS and the DNP program.
Mm-hmm. Yes, okay. We are. And for those that don't know, we actually graduate the most number of Black nurses in the state of Maryland. Oh. We've had our program for a long time. I want to say it has to be a good 50 years or so that we've had a nursing program. And so it's just beautiful to see how it grew from when I started doing nursing back in the early 2000s to see it, almost 20 years later, and to see all the different, programs that we're offering. It's so beautiful. So Coppin State University, as an HBCU in nursing, we are growing.
And what are you teaching?
This semester, I taught health policy and epidemiology.
Oh.
So the health policy I enjoyed. I truly love it. And that's because, side note, I'm also commissioner for African Affairs for the state of Maryland. So I'm very passionate about immigrant health. And I'm very passionate now about policy. And shout out to Dr. Ernest Grant, former president of the ANA, who did a lecture while I was doing my DNP at Duke. And he, highlighted a few things about policy. He was like, it's so important for you to join these organizations and pay those dues, because those dues go to lobbying for nurses, right? If we don't do that, then we're not going to be able to get rid of these collaborative agreements that we have in different states. And it just allows us to be able to have that access and to provide care the way we need to do it without barriers, So teaching that to my students is, it's eye-opening, and they're like, oh, I never looked at it like that. You're right.
Yeah, I love policy too. And you pointed out really important things. If it comes from those mentors, there's those nurses in senior positions, it's going to make a difference, because that initial going in, you just think skill set and direct patient care, and you don't realize that industry, the bigger role, even our colleagues. I think that's where that question's even coming from. Exactly. Why would you get this graduate degree if you're not going to get paid more, if it doesn't have anything to do with clinical hours? Because our influence is beyond the patient. And in fact, all the things you're complaining about being able to provide care can only get fixed out here.
That's right. 1,000%. So yeah, Dr. Madison, you get it. You get it.
You did mention dues, and so I would be remiss if I didn't ask if you're a member of DMPs of color.
Oh, without a doubt. Am
Oh,
I very much. Okay. The first 500.
yay, 500 over here. Yeah. Are you going to the conference?
I am. I'm going to be at the conference, most definitely.
Because you're a sponsor, shout out for giving. That's another way you can support.
We got to try. When you shared that information with me, I was like, oh my God, yes.
Yeah. Are you going to have a booth too?
So I'm not going to have a booth this year. We're actually, so with DMPs of color, we now have a global affairs sector now. So I'm actually working with Danielle to expand on that. So very soon we're going to share some information on the international piece of DMPs of color.
Oh, the Ghana part?
Yes.
I'm so excited about that.
Yes. So you're hip to it. Yes.
Oh,
so
yeah.
we're actually working on setting that up so we could start sharing it with the organization.
So excited.
Yes.
So you told us about the mission and vision for your business, Capital Multi-Health Group. Who's on the team?
So I am one of the 2 nurse practitioners. I have another nurse practitioner by the name of Ethel Elad. She is based here also in the DMV. She went to Ohio State University. Patients love her. We do not have an actual therapist on site, but we are connected to neighboring practices that are therapy based. And so, we always encourage, especially for our mental health piece, we always encourage medication management with therapy. So even though we do the medication management piece, we're also referring you to a therapist that we always make sure they accept your insurance, because that's the other thing, no hoopla. And these are therapists that we've actually developed a rapport with. We have relationships with them, and we actually meet and discuss our patients' care. So
wow.
Yes.
That's a nice model.
It's a very nice model.
And these are all kind of providers?
Yes. So mostly therapists that do CBT or cognitive behavioral therapy. We have one that does dialectical behavioral therapy. And then, of course, for those that need anything like a TMS or a ketamine, we do have a clinic where we send our patients to for that.
Okay. So you don't do like the talk therapy?
So I do talk therapy.
Okay.
I actually do talk therapy, but for individuals that will need a little bit more than that, we also always want to send them to a specialist. But yes, and matter of fact, our medication management time is tied into talk therapy. So you have at least 30 minutes. A allotted visit time is no less than 30 minutes with us.
Wonderful. So speaking about services, what also are the services that you offer?
So we, because I'm also a family nurse practitioner, I do physicals. So I have patients that'll need certain occupational physicals, work physicals. I do sports physicals. I also do substance abuse. So for patients that are needing Suboxone, we offer that service. And then we do medical weight loss as well. So for those that are needing, Zepbound or Wegovy, the semaglutides, we do offer that, because primarily my patients are mental health with some of the drugs that do cause weight gain. So I was like, you know what, let me bring the weight loss piece into the clinic so I can also treat and manage that. And of course, we also do some medicinal marijuana for those that are eligible. So those are the main services that we do. Oh, and DOT physicals. So the transportation folks, they need physicals. We just have them come on down.
You really are multi-health.
I told you.
Right before you said DOT, I thought you were going to say aesthetics or Botox. That's what I thought was coming in there.
I'm not even gonna lie. I thought about it. And I was like, I'll stay in my lane. I'll keep the aesthetics out and send patients to my friends who do aesthetics.
And so if there's someone who wants to be a patient, what's that experience like, from the website to scheduling an appointment, the visit itself, and then the follow-up and long-term relationship?
Oh, absolutely. So we normally encourage our patients to give us a call or send us an email. And literally, once you calls are easy. Your phone number, just give us a ring and we send you all the information via email right then and there. We try to get you seen within a week. That is the goal, if not 2 weeks at the most. But we're trying to get you in, especially for mental health services, because we know that time is of the essence when we're trying to treat that. So normally within 2 weeks, you would get an intake appointment. We'll assess, see what's needed. If we need to refer you out, do you qualify for medication management? A lot of patients get scared in terms of, are you just going to shove medicines down my throat? Absolutely not. We're not going to do that. We're going to have a conversation. So we're definitely going to talk about that. And then for the others that need the other services like sports physicals, we do walk-ins too sometimes for physicals. But depending on what's going on, there might be a wait, but we try to get them in and out as soon as possible. You mentioned follow-up. So once you get your intake done, normally or if you are going to need follow-up tends to be within a 2-week span, and we just kind of take things from there.
And are you open Monday through Friday?
Monday through Friday, from 9:30 a.m. to 5. We normally round up at about 5 p.m. with our last patient. We do not do weekends. We try to be, that's our Zen moment so that we can be ready for you all Monday through Friday. But we do make exclusions for individuals that may need a Saturday here and there. We are flexible and open to that. And even evenings sometimes, depending on what's going on. For example, like 4th of July week, we know that we're not going to be in the office 4th of July or Juneteenth. So maybe on a Monday or Tuesday, depending on availability, we might stay a little bit longer. So we do our very best to create flexibility for our patients too.
And is there a patient portal? How do people communicate? Just the phone and email?
Just phone and email. We try to keep phone, email, and actually text. We actually have a dedicated phone for text messaging for our patients, because we realized, again, during the pandemic, when we would send in reminders, we started doing it via text during the pandemic, and we got a really good response from that. So patients love that. They're just able to confirm via text or send us a message via text, and we respond normally within 24 hours.
I love it too. It's a great reminder.
Yes, because with the portal, for our elderly folks, they have trouble with access. But so we definitely just kind of keep things easy. Phone, either call us, leave a voicemail, or send us a text message.
And so, before we get to cost and coverage, since we're still kind of talking about services,
Sure.
One thing I like to do, since we're 3 Black women, we try to make sure that we're representing other people who aren't present at the table. So when it comes to those vulnerable populations like children, elderly, veterans, the LGBTQ plus community, do you have any particular services for them, or even those who speak a second language?
That's a great question. For the veterans, we tend to give discounts for our cash services for sure. We do for like our weight loss, our physicals, we do give them a percentage off. Even medicinal marijuana cards, they do get a percentage. For our geriatric and adolescents, not necessarily. But what I will say though is for some of our patients that we do see that really like our care and they want to bring their family members along, we're very open to treating the family. For example, I might have a patient who has a daughter who is 8. I tend to treat from 10 up, but because you're my patient and you like my care and you want me to treat your child who's 8 years old, I normally just go ahead and take them on.
Oh, very nice. I appreciate that.
For sure.
And so
that's the thing about nurses. That's because we get it. We have our policies. We try. There's just sometimes where you just can't be stringent. So.
That's such a good point. And let's talk about cost and coverage.
Yes.
Are you cash-based or you accept insurance?
We accept insurance. So for all the mental health services, we do take insurance. For the other services that we offer, they are cash-based. So for mental health, we accept literally everything except United Healthcare, unfortunately. We don't accept United Healthcare, but we do take Medicaid. We take Medicare, Aetna, Cigna, Blue Cross Blue Shield, TRICARE. We are game for them. And then for the weight loss and the physicals and the medicinal marijuana, those are cash-based services. And I'll be honest, we know that there's some individuals who are struggling. So if you may have a code like a high deductible, and for those that may not have insurance that come to us for mental health services, our pricing for an intake is, I want to say $150. And then for follow-ups, they're $100. But sometimes we'll create some kind of what do we call them? Oh gosh, it slipped me, but we'll work with you pretty much. So if you're telling me today, I know it's $100 for a follow-up, all I got is $50, work with me, I'll pay you in 2 weeks kind of a thing. we're game. So we do work with our patients. They know that.
Oh, wonderful.
Yeah.
And then do you have like membership subscriptions or
I
concierge services?
actually don't. But my girls at the office have kind of thought about that, especially for the weight loss, because that's definitely a growing service. So they're like, you know what, maybe we should think about doing some kind of a subscription. And so that is something that I'm considering. But at this moment in time, we don't have any.
Okay, wonderful. And do you do hormone replacement since you're in the weight loss game?
I don't. I've kept it pretty simple for the weight loss.
No, that's good. It's really popular.
It is.
So before we close out, is there anything else you want to say to the audience or tell us how we can connect with you?
Oh, please connect with us on Instagram at capital CAPITAL You're more than welcome to always call as well, 667-307-4173. And our website, please check us out and you'll see all our services. You'll see all the providers. We're at www.capitalmhg.com and we would love to serve you. So please shout us out.
Wonderful. And we'll put all your contact information in the description box.
Thank you. I love that.
Well, it's been a pleasure to meet with you, to learn about your journey and your impressive business.
Thank you. I appreciate you.
Yeah, so thank you, everyone. Remember, you can email us your questions or show ideas to tmi.melanin@gmail.com. If you haven't already, please subscribe to our YouTube channel and follow us on every social media platform. Say hello in the comments when you get there. Please share the show with your friends, rate us on the Apple and Spotify podcasts, and leave a comment. It's your way of supporting the show, and it helps get the message out there to those who need it. You can go in the description box and find the link to our Patreon page. We have a community initiative to go into schools and teach the students and the staff about the importance of primary care and how to accurately measure blood pressure and what to do with those numbers when you see them. The money that you contribute to that Patreon page will be used to purchase blood pressure monitors. We already got our first donation of 5 monitors, so we thank you for that. If you have any questions about how you can further support us, you can contact us directly. And I believe at the time of this airing, our merch store is open. So that link will be in the description box too. Nice. It's season 3 when this is airing, I believe. So we're releasing shows every Sunday at noon Eastern on YouTube and all your favorite podcast apps. Thank you, Dr. Atabong.
My pleasure. Thank you for inviting me.
Can't wait to meet you in person.
I can't wait too, girl. I can't wait.
Thank you, everyone watching. We'll see you next time.
Alrighty.